This conference will now be recorded.
You know, we're all professionals, and we go to these meetings. This one's particularly special. We go to the meetings, we begin to meet people, like-minded people, and if you come back every year, all of a sudden you're going to recognize faces, and this becomes part of the family. It's part of the IMAET family, and it could not ring more true for me than with Khadijat Quadri. She's
Recording in progress.
I met when at the, I guess 3 years ago when we had one of these symposiums, and one of the persons that I truly cherish, and I'm so grateful that we have this sort of thing to run into, because we're all so busy and we don't make time to run into one another, but our interests bring us together, and it's such a wonderful thing. So, you know, I think it's just another thank you to Dr. Bernard Australia to bring all of these like-minded people together. So Khadijat is in Raleigh, North Carolina, and she's a holistic psychotherapist. She's an astrologer, a Reiki practitioner, a shamanic healer. And when I met her, she was finishing off a 20-year stint in the military, treating members of the military, and retired for PTSD and for mental health disorders. And some of the stories she had to tell were just amazing. And at the time that I met her, she had just gotten an IMAET, and it has, like all of us, elevated her desire for the passion of healing that she has today. And we're looking forward to the story, your story. It's so great, Khadijat. Thank you so much. And thank you everyone for coming back in. It's going to be so loud. Okay, so to be.
Good afternoon. Thank you so much for gracing me with your attention. Thank you for the opportunity to be here today to share my story and my work. So for the last 25 years, I have been a psychotherapist, a clinical mental health counselor. I operated my own private practice, initially in San Antonio, Texas, and then recently in Raleigh, North Carolina. And through my own spiritual journey, I began to incorporate other modalities. I went back and studied shamanic healing, and because of my own clairvoyant experiences and making meaning of my own dreams and my own path in life and healing from my own traumas, I also went ahead and studied astrology because I love astrology so much. It always fascinated me. And then I went on to, study aura reading, aura imaging, biowell assessments. And the IMAET was my latest toy, and I was just absolutely enamored and excited to add the IMAET to the repertoire of the services that I provided to the San Antonio community for 25 years, and then now newly in North Carolina. So my specialty has been post-traumatic stress disorder. I have been very fascinated, not fascinated, but it had been my major interest. So for some reason, intuitively, I just wrote PTSD, it is not what you think. It is not just about catastrophic experiences. If something were to happen today, God forbid, an earthquake. I mean, we just had an earthquake in Thailand and in Myanmar, sending love and light to them. And there's so many difficult, catastrophic experiences happening around the world. And we all process trauma differently. Yes, that is true. But it's not just about the experience that causes acute stress. It is when something diametrically opposed to the essence of your inner being, and it enters your field. So the shamans of the old, they understood this. They understood that when something terrible happens in a community, the community has to come together and heal together. Because they understand that when one person hurts, everybody hurts. And it's not about you or them. It's about everybody. It's about collective healing. And so the shamans will come together. And then they will go into the altered states. And then they would see into the field of the individual. They would see the broken aura. They would see where the soul took flight. They will see where the essence of the person has left the field in order to take safety. And through song and dance and sound and prayer, they recall the soul back into the body. And the community comes together to welcome the soul back and to nurture that one person back to healing and back to wholeness. We have vastly gotten away from that. And it is now about our individual healing as opposed to collective healing. And so I wanted to share a story with you that got me on my journey. In summer of 2012, finding myself divorced with 4 young children on a therapy salary. And my practice wasn't doing as well as it could be. And a seasoned therapist came to me and she made me an offer. She said, Khadijat, as you can see, you don't have that many people on your couch. Maybe you want to go out to Killeen at Fort Hood. And everybody knew about Fort Hood. Fort Hood was a military base where soldiers going through multiple tours of duty with chronic PTSD, they were recording suicides on a daily basis. And they kept it hush-hush. And there were not enough therapists to fill up the load. And so they were, it was all hands on deck. And I said, you know what? I need the income. I'm going to go. Killeen is 3.5 hours from where I lived. And so every Sunday, I'll pack my little bags, I'll kiss my children, leave them with their father, and drive 3.5 hours to Fort Hood. I would spend the night at the Fairfield Inn Hotel, and then see soldiers on Monday and Tuesday and drive back. One night, just not long after I started going out to Killeen, I was in my room. I had checked into the hotel, and this hotel, at the time, there were many soldiers. I think they were going to have some type of conference at the hotel. I didn't pay any mind to it. And so I'm in my room and I'm about to retire. And out from my visual periphery, I see what looks like a silhouette of a humanoid being with a reptile head and a tongue of a snake and a ridged head. Before that, I didn't know anything about, that. I didn't know anything about that. I didn't read any books. I was actually an avid student of a Course in Miracles. Anyone a student of a Course in Miracles? Beautiful. I still read it. I still do the workbook. Still listen to it on my way here. And I knew from my study of A Course in Miracles that you do not show fear in the face of an atrocity. And so I was quiet and I stayed calm, and it was physical to me, but it probably likely was not physical to other people, but I saw it physically. And in that instant of a moment, there then began some type of a telepathic communication going on. That's the best way I can describe it. And what I was sensing from this entity was that 2 things. It had waltzed into my room by accident. It was looking for someone else. And then it was surprised that I saw it, and his cover was blown. And then for some reason, I began to see what was behind him. When I say what was behind him, what he was about. I started to see a full picture. And the full picture I saw was it felt like, it looked like outer space. And warships, you know, those like Star Trek warships in outer space. And there was a war going on in space. And the best way I can describe what I was being shown to me, the best way I can describe it was two warring beings fighting for who gets to have control of humanity. It was like two poultry farmers fighting for the chicken coop. One faction has been extremely horrific to human beings and controlling. Now, controlling in the sense that the chicken coop was very tightly woven around you know, the chicken with the humans. The other was upset that this faction was mistreating the chickens, or the humans. And that the humans deserve a bigger chicken coop so they can run around, but not too much, just a little bit more. And it was from that moment that we began to get this explosion of, I mean, you know, the community and the internet. I mean, this was 2012, and the internet was just coming into, you know, into popularity. And what I also learned from A Course in Miracles is, I was thinking in my head, Holy Spirit, remove the delusions in my mind. Remove the delusions in my mind. But I could not deny what I had seen, and I could not share it with anyone because they're going to think I'm insane. Well, I don't have any time to process that. I have to get to work and see all the soldiers. But then something began to happen next. There was all these soldiers who were walking in with these entities. And I could see how they were siphoning their energies and how they had plugged in, just as it was able to plug into my mind. It was plugging into the minds of people, to the point where even when I saw what I saw, I still ask myself till today, wait, how did that happen? Did it show me something, or was it me that plugged into it? I still don't know the answer till today. So it occurred to me that I really, truly want to be helpful. And I truly want to help heal. Because I saw them as the most amazing people who were giving their lives in sacrifice so that we can have freedoms. And here they are, completely ravaged by trauma. So when people talk about emotional, or it's just, you know, you just are too sensitive, get over it, put on your big girl panties on, and it's big. That it's more than that. It's greater than that. And I respectfully agree with healing the mitochondria. I'm sorry, I'm a therapist, so these names are beyond my, you know, purview. And healing the DNA, and the IMAET has taught me a whole lot about that. But it is about the mind. The mind is everything. And then it is about one more thing. Because there was something else that I saw and I could not share. And I do work quietly. As a shaman, my job, I have only one thing. There's different types of shamans, okay? Now I use the word shaman because in my country, it is called Babalawo. The ancient ones healed with medicine, healed with sound, healed with vibration. And they understood that we lived in a dimension and that they could appeal to higher dimensions for healing. So all of the things I'm hearing today is not new. But I know one thing. I understand that there is a light in each and every one of us, and we have heard this for the last 2 days. If, you know, we know scientifically that there's trillions of cells in our bodies, and that inside each cell is a spark of light. Now, I don't know, I think I heard this like trillions and trillions. Add 300 trillion lights together, and what does it look like? a big ball of light. And what I saw is, your body is simply a contraption. And I think it is important that you take care of it and keep it healthy. And you can dress it up like an Easter egg, okay? And that is great. Because like a chicken egg, we need a healthy shell. We need to keep the shell healthy long enough so we can go inside and do the work that the Maker has called us to do. A seed does not have an easy time. Degrading in the soil, fermenting in the soil. Its shell frizzles, and then it forces its way out of the soil in order to reach the light. Do you think that is an easy thing to do? Ask the trees. They will tell you. It's hard work. And do you think it's easy for an egg to turn from the egg white and the yolk into a bird and push its way out of the shell so it can become something new? We human beings are no different. There is something inside of us. It is the spirit man and it is the light. While you are on this planet, in this shell, make sure you are transforming yourself through your own experiences. So for me as a shaman, I only have one healing tool because I know one thing. Only one thing can heal, and that is the light in you. Until you get with the light in you, you will find all kinds of healing remedies, and it will fix you for a while. It is the aspect of God in you, in everybody. It is the part of you that heals you. So when there is, this was the other thing I saw in my experience with the soldiers. And by the way, I mean, I started having people coming to me and telling me about UFO abductions. And they said, Khadijat, I know you're going to not think I'm crazy. I said, no, I don't think you're crazy. In the book by Conversations with a Shaman by Carlos Castaneda, he did talk about the flyers, that we do have predators. And until we come together, it is a divide and conquer. And what does the flyer want? It wants your light. Because your light is like a child, believe it or not. It is the part of you that is creative, the part of you that is loving, the part of you that wants to go out and play. When you think about when you were 6 years old, you are thinking of your light. It is the part of you that is authentic, simplistic, but all-knowing and intelligent at the same time. But most importantly, it is the part of you that will lead you home when your time is complete in the dungeon of the demonage. So we cannot, Dr. Fraley talked about the bipolar continuum. The conventional health paradigm and the bioenergy and the rising bioenergetic healing paradigm. And it is no smooth art from ignorance to enlightenment to understand how the mind, body, and spirit interplays with each other. But I know that the IMAET can further and bring that bridge. Because one thing it has done for me is to help educate my clients. Because it is not about physical healing, more so about a consciousness shift. Because when the consciousness shifts, the body will respond. So we cannot heal a body without a coordinated effort to heal the main consciousness. And a quote from A Course in Miracles. Psychotherapy is the only form of therapy there is, since only the mind can be sick. Only the mind can be healed. Only the mind is in need of healing. This does not appear to be the case, for the manifestations of this world seem real indeed. Psychotherapy is necessary so that an individual can begin to question their reality. Sometimes he's able to do it, start to open his mind without formal help. But even then, it is always some change in his perception of interpersonal relationships that enables him to do so. Sometimes he needs a more structured, extended relationship with an official therapist. Either way, the task is the same. The patient must be helped to change their mind about the reality of illusions. Sickness is not real. It is a defense against the truth. It mocks the truth of our being. We are not sick because the light can never get sick, because the light in you is you. And so until we begin to change our mindset about healing sickness and to focus our psyche on the light, we will continue to dabble in delusions. So PTSD did not even begin to gain any attention until the 1980s. Before then, even when there was the Nazi Holocaust and Hiroshima and Nagasaki, they still did not come out and say that there is that people are experiencing something very severe. So even in the DSM-3, in order for you to even meet the criteria for PTSD, it has to be something that is so catastrophic and is outside the range of usual human experience. Stressors such as war, torture, rape, Nazi Holocaust, atomic bombings, Hiroshima, Nagasaki, natural disasters, earthquakes, hurricanes, explosions, airplane crashes, automobile accidents. And you know we've seen quite a bit of that in the last year or two, haven't we? But now they're saying that it's not just about catastrophic events. That now chronic stress over time, like a child who's been abused or living in prolonged illness, poverty, can set the stage for later onset of PTSD. For me, and from my personal experience, and I know that we all have different experiences, what I saw with the soldiers and what I've seen with a lot of my clients is that PTSD begins when something unordinary stuff gets in your field. And you need a trained healer that can identify the source of the attachment, of the parasitic attachment. And the healer must support the client in moving their minds in the right direction. It is easier said than done. I can quote all the great literature to you, but it's not the same when you actually experience. Just as Laurie said, it is not about what you know, it is about what you have experienced. And so, because of how complex PTSD is, right? It's very hard to even pinpoint any particular thing that's going on. We have to work on several levels, from the physical, mental, emotional, and spiritual. I like to start from the spiritual, and then I walk my way down. Because to me, in my world, that is the source of the problem. Because now, when we go back to thinking about what the shamans did, when we go through stress, anxiety or depression, or we're just scaredy cats, I know I'm one, right? And we freak out over everything. It affects our aura. It thins our aura. And it's almost like a vehicle that got broken into. And now you have an open window. And then debris and things can get into the vehicle and create devastation. So in a physical level, it starts to show up as inflammation and parasites. But those parasites are energetically in alignment with entity attachment. So while you're doing a detox, make sure that you're doing the spiritual work as well. Because the parasites are low vibrational consciousness, connected to the low vibrational consciousness of whatever entity it is that is attached to the field of the individual. So my research, going back to the bipolar continuum, and in my own feeble attempt, was to bridge the two opposite worlds of conventional medicine and the bioenergetic world. Because as someone who works in the conventional mental health, I know how they think. And I know that they have done little to nothing to further the understanding of the human mind. I wonder why. And it is not just in the United States, it is around the world where mental health is viewed with such cynicism, when it is the actual issue that is rampaging our planet. The collective consciousness of humanity is in big trouble. And so I asked the bioenergetic world, because I know you are going to rise, because nobody's going to come over here to your other side anymore, because they're not going to trust it. But I ask you one favor. Please do not ignore mental health. Please do not relegate it to the IMAET emotional panel. And the reason why I say that is that you cannot find an easy way out to consciousness development. You've got to let your clients know that the IMAET is amazing for bringing you to alignment so you can further your work, so you can align to your spirit man, and your spirit man can align to your light. And you have to make that balance, maintain that balance. And the IMAET is phenomenal in helping you to do that. But like how we are on this planet, we're always looking for a quick fix. And the work to become an angelic being is not a quick fix. You do have to work for it. The Creator requires that. And you have to earn your right to be in the heavens. The Creator requires that. Because you cannot go to the heavens and act a fool. You do not go to the university and you didn't pass your GED. So why would you think that you can sit in the kitchen and Archangel Michael is going to bring you tea and entertain you? I mean, look on the internet. That's not how it works. You're not going to take the pen from a kindergartner and write for them. You're going to take the kindergartner, keep going. You can do this. But not to take away the hard work of experience, of kindness, of forgiveness, of compassion. You cannot forget to do the work because the spirit man needs that experience. So this is a feeble attempt to bridge the gap. I don't know if I succeeded. I can only try. My case study is, I submitted the paper to the Journal of Complementary and Integrative Medicine. And it is involving one participant. Don't call her out. So basically, I'm looking at how the IMAET can be used as a complementary treatment for the uptake of serotonin levels in post-traumatic stress disorder patients. It is my little way of bringing kindergartner message to the mainstream. So I know you are far more advanced than this, but if I can be as scientific and coordinated as I possibly can, maybe they can follow what I just did, and maybe I can then apply and apply the same approach to a wider sample. So we have heard this many times, right? Where we or our family members have a diagnosis, and then you ask your doctor, well, how did I get that, right? And what do they always tell you? We don't know. I don't know how you got cancer. It just happened. Oh, wow, okay. So, there is a direct link between psychological stress and later onset of disease. Mr. Lee, teacher of Qigong, Falun Gong, talks about that what causes people to become ill is 70% psychological and 30% physical. Dr. Spalowski, in his book, Why Zebras Don't Have Ulcer, he says that the diseases that plague us now are ones of slow accumulation of psychological stress. So whether it's heart disease, cancer, inflammatory disease, cardiovascular disease, he describes that when we are constantly in a state of stress, and if I recall, because I absolutely love this man, I went to his book signings, and incredible scientist, and I think he watched zebras in the wild for years, and then he attributed the constant fight and flight mode we're in is literally the same stress response as when a zebra is running from a lion. And our brain does not know that we're actually not running from a lion. We're worried about bills and other things. So stress is one of the main factors often studied that many people believe is related to health and disease, and provocative evidence also associates increased stress and verified organic illness. So again, post-traumatic stress is likely one of the most complex physiological mental health problems to treat because it cuts across physiological, mental, emotional, and spiritual complexes of an individual. And yes, chronic illnesses, genetic mutations can be attributed to psychological trauma. So we know the mainstream, after waiting till 1980s to say, oh, PTSD is an issue, they really didn't start doing research until about 20 years ago. And they really didn't start identifying treatment approaches until about maybe 15 years ago. And look at the treatment approaches they found. By the way, none of them worked. So, in fact, they're actually possibly detrimental to the patient, because when you are taking these psychotropic medications, it just puts all these unnecessary things in your brain. And people actually get worse. I haven't had a client tell me, oh, I was on Suprexa and Zoloft and Xanax and gabapentin. I had one patient, and she was, God bless her heart, she was only 28 years old, and she was on 5 psychotropic meds. And when I spoke to Dr. Straley about it, he said, so they probably gave her too much serotonin, and when you have too much serotonin, it has the same effects of anxiety and depression and shaking, and it's even worse. And I can't tell you how prevalent this is. Then there's traditional talk therapy, such as cognitive behavioral therapy. And that's the big buzz. And okay, don't get me wrong, it's not that bad. But they treat it as if it's the end all be all. It's not. I think it can help for a little bit until it doesn't. Then there's biofeedback interventions. Okay, you're moving your eyes. Actually, that might not be bad. So the eye movement is not that bad, but they're having people move their eyes left and right, which does help with trauma reprocessing but again, it is not sustainable. It's temporary. Then they brought ketamine therapy and psychedelic assisted therapies. I mean, they did a whole feature on 60 Minutes on psychedelic assisted therapies. So now we know that they want to take our veterans on ayahuasca trips. And I don't have anything against ayahuasca or mushrooms or any other journey, journey. I mean, I am a shamanic healer, but I don't recommend using shrooms and other things to go on shamanic, to heal. And the reason why I say that is that 9 times out of 10, they will come back with entity attachments. And they will be fine. Oh, I saw myself and I was in the universe. Okay? And I explained to them, let me tell you what you just did. You imagine a 10-year-old boy who's playing on the trampoline and he wants to see the neighbor, what's going on in the neighbor. So he gets on the trampoline and he jumps and he looks, and then he jumps and he looks. And then he gets obsessed with jumping and looking. And then what happens eventually to his legs? He could hurt himself. So it is, to me, going on a journey is like you coming out of your shell before it's your time. It is like a chicken that broke the shell, so it looks at what's happening on the beach. And then you have the people talking about astral projection. For what? Stay in your shell. Develop yourself. Be grounded. Go and help somebody you need. That will move your spirit man going. Because one thing people don't understand, and I've watched many OBEs and near-death experiences, and I said, look, first of all, your spirit man did not have an OB and did not have because if your spirit man went and had that, you will be definitely dead and you will not be coming back. Because the maker made sure that you are perfectly sealed inside your body. But he did give you a counterfeit spirit, an astral spirit. So when you sleep and you go flying in the air, that is your counterfeit spirit. And the counterfeit spirit can help you with decision making, go back and forth in time, go and check stuff out, go to the crossroads, and then you wake up and you're like, oh, I had this dream, I think I need to do this. Yes, because that is the job of the counterfeit spirit. After you die, the counterfeit spirit turns into a cloud and poof. And so you do not place emphasis on the counterfeit spirit. You place emphasis on being grounded, present, and here. And when you are present and grounded, the spiritual life will open up to you. So this is what they have to offer for mental health. So when my clients, come to see me and they say, what is a chakra? Because I do have, most of my clients don't even know what a chakra is, or what is meridians and all these fancy things. So I give them this analogy. I say, you have a vehicle? Yes. Okay. You have 4 tires? Yes. You have all these incredible wires and stuff going in your vehicle, right? And you have liquids and gases and all kinds of things in your car, right? Okay. So what keeps your tire snug and tied to your car? It is large screws and bolts. And then you have big screws and bolts, you have medium screws and bolts, and you have tiny screws and bolts. Now the big screws and bolts are your chakras. The medium screws and bolts are your meridians, and the little ones are your acupressure points. So your spirit man is the one that is energetically feeding your body through the energy systems. It is not outside of you. Let me repeat, it is not outside of you. Your energy is coming from you. And it is coming from your light. And when you align your mind, because your spirit man and your body share your mind. So if you want to truly know who you are outside of the shell, look inside and look at the way you think and see how you are shaping yourself, your eternal self, every second of the day. And at the end, like a report card, you will see the totality of what you have made of yourself. So when you speak ill of someone or you don't like someone, you're not hurting someone. You're hurting yourself. So imagine if you're driving down and you hit a curb, right? Has that happened to you? Happened to me many times. You hit a curb, and what happens to your tire? It goes, it starts squeaking, and it goes what? The mechanic says, your car is out of alignment. Okay? That is what happens to us when we go through stress. We go out of alignment. The chakras, the meridians are out of alignment, meaning you were like this, your body and your spirit man like this, and stress did that. So now the vortex of energy that is coming from your spirit man to you is no longer able to feed the heart because there is a misalignment. And what I love about the IMAET is that it provides the realignment. Before I got the IMAET, I did the alignment myself. I can only do so many alignments a day. It's very exhausting. But I enjoy doing alignments physically. So there is work to be done within the self. We have to maintain the alignment, which I like the IMAET, helping to maintain alignment. But then after you are aligning yourself and the IMAET is helping you, you must then begin to further the work. To love on yourself by putting attention to your spirit man. And then your spirit man then puts attention to the light. And then through your experiences, you are able to increase your consciousness. And then somehow, like the egg white and the egg yolk, the spirit man and the yolk, you turn into a bird. A beautiful angelic bird. That's what it's about. So, this is the design of my research case studies to determine the efficacy of the IMAET in treating serotonin uptake in a patient with PTSD. And I used the DAPS, the detailed assessment of post-traumatic stress, to assess the patient's hematology. So I did a before and after of the, before I started treatment, and then I used the DAPS for after. And I know Dr. Straley asked me, why you want to use the DAPS? Can't you use Alicia's QEEP, and I did consult with Alicia on, how to do this case study. And Dr. Straley's suggestion was, we can blood test and, see pre and post of serotonin. I chose to do the DAPS because that's what the military use. And that is what clinical therapists use. So I am trying to bridge the gap because that is what they understand. I have to speak their language and then take them baby steps. So I did the DAPS before, and then at the time when Angela came to see me, she was actively suicidal. And so I was not going to put her on the IMAET immediately because I needed to stabilize her. So I did sessions with Reiki, and I did hypnotherapy. And because I only have 1 hour per insurance, I combined the two. And then after the Reiki and hypnotherapy sessions, then I started the IMAET, and then I administered 5 sessions of the show method protocol. And then after that, then I did 5 sessions of, so what I did was I went to the allergy panel, I, type serotonin, right? And then everything related to serotonin will pop up. And then I scan everything that popped up with serotonin, and then I check all the numbers, and then I recorded all the numbers, and I did it every week for 5 sessions. Does that make sense? So whatever pops up and the numbers, I put it in the treatment basket, and then I do a feedback. Okay. With all the IMAET sessions, of course, I did a calibration, I did the spinal, I did the meridians, I did the fluid balance, treatment basket, emotional panel. And then so this was 14 weeks of therapy. And so after recording all of the serotonin, so serotonin markers and everything related to serotonin, and I put all the numbers, on a table, which I will show you in a minute, it showed that she had a 41% improvement in her serotonin levels. So my conclusion was that the IMAET was successful in restoring serotonin levels and reducing symptoms of PTSD. So yes, a larger randomized control study to validate this result is warranted. So, serotonin. We know that it is the happiness hormone, right? What makes us happy? Like a kid in the candy store, like orgasmic bliss. Without serotonin, we're miserable. And so, but unfortunately, so connecting serotonin with PTSD, I think Dr. Straley had already talked about. Scientists are unsure what causes serotonin deficiency. Some research shows early life stressors might negatively affect the transport of serotonin in the body. Other research, trusted source, show that microbes in the gut help produce serotonin. This production might be disrupted when the microbiome or gut bacteria as a whole is disturbed because of stress, disease, diet, or other causes. So medical professionals generally don't diagnose serotonin deficiency and choose instead to treat the symptoms. I don't know if that has changed recently. Maybe you can all correct me here. It has not changed, okay. So this is because serotonin deficiency is a complex condition whose cause is very difficult to nail down. There are no diagnostic criteria, and it's often unclear whether the symptoms cause the deficiency or the deficiency causes the symptoms. So there's a test that measures the amount of serotonin in your blood, but medical professionals typically use this test only to check for tumors that produce serotonin outside the brain. Your blood level of serotonin does not accurately reflect the amount in your brain, which I found very interesting. So then how does serotonin get in the brain, and how does it get maintained? I mean, I'm thinking maybe it's like being outside in the sun, having fun, playing, I don't know, but it seems nobody knows how we get it and how we keep it. I think there was a study I read about some monks who were tested for their serotonin, and they were found to have high levels of, healthy brain, frontal lobe, serotonin levels. They were very happy people because they were avid meditators and they practiced qigong and tai chi, and so maybe serotonin comes from being positive, maybe it comes from being playful. We don't know. So to talk a little bit about the DABS assessment, it is looking at several criterion. So I'm hoping that in the future we can do 3 things. We can do the DABS, we can do the blood test that Dr. Straley suggested. We can even do Alicia's G, okay. So we can do the 3, and then we can have several patients, and then we can do a post-test. But for this one, I just did the DABS. I think that the DABS in itself is unique because it is checking several things that I don't think the QEEG and the blood test will look at, which it is looking at, relative trauma exposure, peritraumatic distress, peritraumatic dissociation. So quick one on dissociation. So anyone had an accident and they are, and they are out of it. It's like they are in a hypnotic state. They're like, it's like your life is flashing before your eyes. And then the paramedic come and go, what is your name? How many fingers do I have? And they're talking to you and they're giving you positive suggestions. They're doing it intentionally because during that accident or during that catastrophic experience, you are in a dissociated state. So what happens in a dissociated state is that you have to protect your spirit man in that impact of the trauma. And so your spirit man have to move out of your body in order to avoid the impact. And so a positive suggestion during that time, because a person is 99% suggestible during that time when they are in a dissociated state. It is the same technique I use in hypnotherapy, but for good purposes. So, so as they are talking, the patient, the person, and saying positive things, there's research that shows that they are more likely to heal faster by listening to the positive suggestions of the paramedic. The shamans also know about dissociation because they say what? The essence leaves the body and takes flight either to the upper world, the middle world, or the underworld. And the shaman has to go and look for the lost soul part. And I did that for a while before I got the IMAET. I would go searching for the soul part. And there were times that the soul part told me, no, I am not coming back. I said, what? Why are you not coming back? He said, look at her, she's still on drugs. And she's still with the evil man. I'm not coming back. I'm gonna stay with the Dalmatian in the. And so it occurred to me that, psychotherapy was necessary to get a person back to loving themselves and using the IMAET. And then I don't even have to carry a drum and dance around my office because the part just pops back and jumps back into the person. Problem solved. Okay, so, and then there is re-experiencing, where a person is reliving the experience, having flashbacks, effortless avoidance. I think I had soldiers, veterans who they literally will go into a dissociative state where they think that they're back in the war zone. And they don't even know where they think they're back in the war zone, and they're crouching on the floor and they're grabbing their guns and they're feeling the whole experience all over. So the dance is looking at this, and it's also looking at substance abuse. Now, I'm in North Carolina. One thing I do know is that this is a very common problem. What I also saw was that it's the old South. Yes. And a lot of unresolved traumas. And the trees tell the stories. And so it's become such a problem that people can't even handle. How they're going to come together and heal something that had nothing to do with them from 400 years ago. So, so alcoholism, drug addiction, very big problem. The DABS also checks for severity of the symptoms and self-destructiveness. So in and of itself, it has a 85% viability to identify PTSD. But as I said, but it doesn't check for migraines, it doesn't check for hormone levels, it doesn't check for brain states. And this is where the IMAET has been phenomenal in helping me to fully get a better picture of diagnosing PTSD. So, Angela is, sorry I put your age up there. So she's active military, and when she came to me, and I've known Angela before, And I know what a bright and beautiful light she is. So for her to come to see me and telling me that she's having a suicidal thoughts, I knew it wasn't her. And so she doesn't take psychotropic meds. She wasn't getting the care she needed, and she felt a lot of medical bias. So this is the pre-test that I did. So the clinical skills is looking at, fear, level of fear, helplessness, horror, guilt, shame, disgust, upset. And so it's calculated her raw score and her T-score. And you can see the top black is her responses and the blue is the average response. So she was really off the charts with regards to her responses. And so she met the criterion for PTSD on all the criterion A, A2, B, C, D, and F. She tested positive for being a severe range of PTSD. And so when she came in and she was explaining to me what happened, so the first thing I did in order to stabilize her was to do a Reiki session. And usually when I do Reiki sessions, I chant, I play my drums. I still do that because I like it. It puts my client into a alpha theta state. I like my oils and I cleanse my space. And then I began to go into that alter state when I drum, and then I can see the misalignments in her field. And then intuitively, I just began to move her back. From what we saw, and after the Reiki session, what Angela reflected back to me and which I saw was that she was not, so when the experience happened, she kept saying, I'm not in my body. I don't feel like myself. And when my client tells me that tells me that they have lost they've lost a piece of their essence, or it is not within they're not in the body. So what I do is I ground them back in their body with the sound and the music and the drumming and the meditation. And so Angela reflected back like she felt like she was back into herself. So then we did more. So the next 4 sessions was to release the intrusive thoughts, which is, the energy. So we came to the conclusion that she was on a base in Japan, and everybody on that base was talking about suicide like it was a fun thing. And I think that somehow she picked up on that energy, or somehow the energy entered her field. And so when she felt it, she knew it was not of her. And she immediately went to the urgent care. And so the healing session was to release that, clean her aura, seal her aura back, remove all energetic interferences, and I did the polarity balance. And so after that, how are we on time?
How much do you have left?
Yes.
How much do you have left?
Yes. How much time? Oh, okay, I'm almost
How
done.
much time do you need?
I'm almost done.
Let's just finish it.
Okay, all right. So then the next 5 sessions, I then did the show method protocol. And I'm not sure I did it right, but I did it intuitively. And I just went with the list. I made sure that mind-body balance, I clicked all the sections. And then I just went with the basic, vitamin B and hormones. And I tried my best not to do too many baskets because I've been known to pack everything. Oh, just put the whole thing in the allergy basket now. So I did, just whatever was coming up that was reading high or reading very low. I would put it into the basket. So session 5 to 9 was, feedbacking, these basic items. Session 7, iron, vitamin K, NAT. Session 8, boron, brain hole. And then, of course, I made sure that I did other things like, brain balance, the spinal meridians. I did work with the SAR codes if I needed to, fight flight marker. And I think I did a lot with brain too, and thyroid and emotional panel. And so after the 5 sessions, then I go to the serotonin scan and feedback. And then again, just went into the allergen panel, typed in serotonin, everything related to serotonin comes up. I scan it, and then I start single testing to see the numbers. Then I put it in the treatment basket and I do a feedback. So when I do a single test, I record it. So, these were the 3 main items that I worked with. I'm sure there might have been more that I could have added, but they were serotonin receptors, and amyloid gene. And so the week 10, it was 11, 7, and 5, and then week 11, you see it had increased. And then week 12, serotonin levels have increased even more, and you can see the consistent increase. So I'm wondering if anybody has done this, like go in and when you feedback an issue, do you go back and test to see where the numbers are? Yeah. Do you see a difference in the numbers?
Oh yeah, definitely.
Yeah. I always see an increase in the numbers. Like I remember I had a client that had, CMV, and Dr. Surely said, CMV is bad. Make sure you put it on the basket. So I know that. And then if CMV is like 99, the next week, CMV doesn't show up on the allergen panel, I go in and I say, where is CMV? And usually it's doing a lot better. So this didn't surprise me at all. Now I did continue to check even after 14 weeks, but this was the end. I didn't want to keep, recording. I wanted to keep it at 14 weeks. But I did notice that it stayed consistent. Now, there were times that it went back down, like in session 14, the receptors went back down, but then the others went up. So I think I was comfortable with making sure that all the numbers went down, like how session 10 was. So, and then, I would still do the feedback, but I did notice that there was a consistent increase in those on the serotonin levels. So then after that, I did the post-test, looking again at where she is on PTSD, on dissociation, on suicidality and substance abuse and impairment and hyperarousal. And then, so this is the T-score, which is now significantly down. And then I compare pre and post. So you can see it's a significant difference in the pre and post. The pre and post was off the charts all the way up at higher than 100, and then the post had significantly come down. And this is not new. We have had a lot of success with the IMAET, right? Then also, this is another table with the pre and post. And you can see that there's a significant reduction. And so in the areas where, of course, there was still upset and fear, and I think we kind of processed that because this was related to, I think when you're now mad at your employer, it's like, you know what, I'm done. Like, I can't believe you did all these things to me. And I'm just ready to be done. I'm not allowing that to happen. And so I when my clients ask me, there's nothing wrong with healthy anger, because to me, anger is an energy. It's higher on the vibrational scale than depression. In the that vibrational scale, it's higher. So it is where you get all this energy in order to move yourself up. So to me, I would rather my client be angry than depressed or have apathy. You know, and so it's like, how do we channel this raw energy? I think the issue is when you have the anger and you don't do anything about it and you sit with it and it will start to eat at you. So you need the anger to get you moving, to make change and to do things. So I was okay with the upset, and I mean, you know, and then of course there was the fear about confronting these people about the things that should not have been done. So those were natural responses. And again, looking at pre and post, we're seeing a significant reduction in trauma exposure, distress, and dissociation. Avoidance is improved from 46 raw score to 20. Effortless avoidance from 18 to 9, so it's a reduction. Hyperarousal from 46 to 27. Post-traumatic stress from 140 to 61. Substance abuse from 18 to 12, and suicidality from 19 to 10. So this is a very good post result. And so in order to test for PTSD, you have to meet the criterion for all 7 criterion. And so the pre-test, it was all yes, and the post-test, she no longer met E and F, but she still had yes on at least one trauma where she felt a threatened, a serious injury, helplessness, and persistent re-experiencing. So we continue to work on that, but she no longer met the criterion for PTSD. So the conclusion is that, the post-assessment result indicated a reduction of symptoms across the trauma specification scales. Reductions of symptoms were, in exposure, distress, dissociation, re-experiencing, avoidance, effortless avoiding, numbing, hyperarousal, substance abuse, dissociation, and suicidality. So the specific time frame for the assessment and treatment was 6 months, so 14 sessions. Now, this is usually the range for PTSD, actually, this is short for chronic PTSD. And so I think that even after, our session, I think she continued to do amazing, even better than this post-test, I think. No?
Yes.
Yes?
Yes,
Yes.
I'm in a much better place for sure.
Okay, she's doing amazing.
Yeah.
She's here at the IMAET conference. Yes! And I know she's going to be purchasing her own IMAET, and she's going to be doing it. And we're talking about going on base. So in conclusion, the IMAET panel was successful in restoring serotonin levels, reducing symptoms of PTSD. Now here's what I'm gonna say. I don't know that in mainstream has been able to be successful in this. So I am excited. I am happy and proud to be an IMAET user. And I am so excited, and I thank all of you for the opportunity that you have given me to speak today. I hope that we can move forward as a collective together in order to bring more healing to people. And so I just thank you very much. God bless you, and enjoy your dinner.
Khadijat, we are humbled by the implementation of this technology into the dimension of your healing. I know we all feel the same way. I see we're way over time, but I'm going to take one question here.
So you said that you have a way on the IMAET or do you have your own protocol to do that?
To put the spirit back into the body?
Yes.
Well, no, I did that with regular Reiki healing.
Oh, okay, not with the IMAET.
Not with the IMAET. At first, I did that with the Reiki healing, because I mean, you know, I'm sure I could do the IMAET even when the patient is in distress, but I needed to physically touch and bring her back down to her body. So I did it physically,
Okay.
and I still like doing that.
Okay.
Thank you.
Thank you.
Thank you. Do any of you going to the dinner need any more details?